Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, Pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. We got that free 31-page PDF on the top 200 drugs. Simply an email will get you access to that. And of course, support our sponsor, med101.com/store. We've got tons of resources there to help pharmacists studying for board exams, books, all sorts of different content that can help lots of different healthcare professionals. So go check that out, med101.com/store. Support the sponsor and obviously help support this podcast. Keep it free and available for all to benefit from. All right, the drug of the day today is ketoconazole. Brand name is Nizoral. As you could expect from the ending, ketoconazole, this is an azole antifungal. So its use typically going to be used for treating fungal infections. I can't say I've really seen it used for anything else other than that in clinical practice, and its use is pretty rare, and I'll discuss the reasons for that coming up here. But there are a couple off-label uses that have been reported: advanced prostate cancer, as well as Cushing's syndrome. So we have an oral formulation as well as a topical formulation. So topical formulation we can utilize for cutaneous candidiasis, certain types of dermatitis, tinea infection. And I want to talk on the mechanism of action a little bit here. So essentially, as an antifungal, this medication alters the permeability of the fungal cell wall. So it blocks fungal cytochrome P450. In addition to that, it also inhibits biosynthesis of triglycerides and phospholipids that are necessary for the fungus to grow and survive. Now, I alluded to the off-label use of Cushing's syndrome. So this medication actually inhibits some adrenal enzymes that are responsible for cortisol and androgen production as well. And so that's where that mechanism comes into play in potentially having some benefits for Cushing's syndrome. Now, I will say from my clinical practice, personal experience, I've never seen ketoconazole used for that. I'm not saying it doesn't happen, but I would say in general it's pretty rare that you're going to see it utilized for that, and obviously probably going to be a very specialized use in that capacity. Dosing of this medication typically going to range for the antifungal purposes 200 to 400 milligrams daily. Topical dosing depends upon location and what we're utilizing there, of course. With that said, longer duration of use, we can run into some higher risk adverse effects. I'll talk about those a little bit coming up here, but also wanted to mention administration. And I'll throw this out in the drug interaction sections too. But oral tablets should be given at least 2 hours prior to antacids or hours after. And this is to prevent decreased absorption due to the high pH of gastric content. So antacids will raise the pH of the stomach, and that ultimately reduces the absorption of oral or systemic ketoconazole. Okay, so pay attention. Tons of people take antacids, calcium carbonate supplements for osteoporosis, for example. You've really got to pay attention to that and making sure that if we're using ketoconazole, we don't blunt the absorption and potentially cause treatment failure if we give ketoconazole with those antacids. Also, another important note when treating fungal infections, for central nervous system infections, ketoconazole tends to have poor penetration into the CNS or the cerebral spinal fluid, and in general should not be used for the treatment of fungal meningitis. Okay, so an important thing to note, kind of from a pharmacokinetics absorption type of standpoint. All right, let's get into some of the adverse effects and risks associated with ketoconazole. So first and foremost, I would say one of the big reasons you don't see this medication utilized very often, or why you see it kind of as more of a last line type of medication, systemic-wise in treating fungal infections is because it has a boxed warning for hepatotoxicity. So that's one of the big reasons why you don't see this medication utilized. And it has led to situations or cases of liver transplant as well. Another reason potentially is QT prolongation. I'll talk a little bit about this with drug interactions. There are definitely some contraindications there. In addition, there's CYP3A4 inhibition. Again, I'll cover that more in depth in the drug interaction section. But again, as far as adverse effects go, that hepatotoxicity risk is a big one in why we try to avoid this medication. Other adverse effects, GI adverse effects, probably the most common you're going to run into with this medication, can cause some, less common hair loss. Again, that's probably typically going to be more long-term chronic use versus, 7 days, 10 days, 14 days of this medication, for example. But is something to be aware of if somebody is taking it more on a chronic type basis. May see some irritation, some skin reactions, those type of things. Again, not incredibly common. Fatigue, insomnia are possible there as well. I do want to mention adrenal suppression. So high doses of ketoconazole may depress adrenal cortical function. Again, this is typically going to return to baseline once the medication is done. So again, in a short term, treating an acute infection, probably not going to be a huge deal. But if you have the rare situation where you've got somebody on this medication chronically, that's probably something that we need to pay attention to a little bit more so. Probably the most important thing you're going to want to monitor is hepatic function. So liver function tests, making sure that this medication isn't causing hepatic impairment, acute liver failure, and making sure that we're monitoring for that. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, NAPLEX, ambulatory care, geriatrics, BCMTMS, go check out meded101.com/store. We've got tons of resources, help thousands of pharmacists pass their board exam. We can absolutely help you too. So go check that out. If you're a nurse, PA, nurse practitioner, med student, tons of other resources as well. For each individual profession, if you will. Go check that out. All those links to books, other resources, meded101.com/store. All right, wrapping up with drug interactions. This is definitely complicated. Ketoconazole has a ton of drug interactions, and the primary reason being it inhibits CYP3A4. Okay? So we've got cholesterol medications, lovastatin, stimvastatin, antipsychotic medication like lorazepam, anti-anxiety medications, alprazolam, midazolam, dronedarone is an antiarrhythmic, some of the triptans like elatriptan, tamsulosin, ticagrelor, anticoagulants. These are all medications that can interact with ketoconazole. So very, very important. If you're ever considering prescribing, dispensing, you're educating a patient on ketoconazole, my encouragement would be to look that medication up and do a drug interaction screen. Okay, whenever you see an order for ketoconazole, if I don't get anything else across to you today with this medication, pay attention to drug interactions when a prescription is written for this medication. So typically, ketoconazole, by inhibiting CYP3A4, we're going to raise the concentrations of other medications, so your lovastatin, simvastatin, and so on and so forth. So you're going to pay attention to toxicity of those other medications. So, some clinicians, prescribers may, reduce the dose of the interacting member if ketoconazole is absolutely necessary. Some may hold the medication for a period of time. Kind of depends upon what we're doing, what we're trying to treat, what we're trying to manage. But those are kind of a couple options to navigate that CYP3A4 inhibition and the likely alteration of concentrations and or effectiveness with those other medications. Monitoring is always going to be an important aspect of drug interactions as well, where maybe we just give the patient or maybe a caregiver heightened awareness that there is an interaction, concentrations are likely going up, and here's the adverse effect profile, or here's the likely toxicity we're going to run into with this other medication. Let's say simvastatin, for example. Okay, so that's another important piece of it, as well as potentially altering the dosages of some medications as well, if ketoconazole is absolutely necessary. All right, another drug interaction I wanted to mention was ketoconazole is broken down by CYP3A4. So if we get CYP3A4 inducers on board, let's say you got a patient taking chronic carbamazepine or phenytoin, for example, rifampin's another example, these can all lower the concentration and ultimately the effectiveness of ketoconazole. So definitely important to pay attention to that. I alluded to the box warning of hepatotoxicity, so I tend to think about other medications that may be worsening liver function. So high-dose acetaminophen, methotrexate, amiodarone, if you've got patients with disease state or conditions, alcoholism, for example, that may impair liver function already. Ketoconazole is probably a medication that you're going to want to try to steer clear from there. So pay attention to those additive risks of liver failure when using a medication like ketoconazole. I briefly alluded to it. Oral ketoconazole does require an acidic gut for absorption. So again, avoiding separating antacids with ketoconazole is really important. If we give antacids with ketoconazole, what's going to happen is you're going to have less absorption of the ketoconazole, potentially leading to treatment failure. Again, this is oral systemic ketoconazole, not topical. Okay, that we don't have to worry about as much, of course. So hopefully that makes sense to you. All right, last but not least, I do want to mention QT prolongation. So co-administration with the following medications of ketoconazole is contraindicated. So a lot of antiarrhythmics, for example, dofetilide, quinidine, but there's also some other medications as well. I alluded to lorazepam. Methadone's a kind of a classic example of medication that can have some QT prolongation risk. So again, remember some of these medications, remember the QT prolongation cumulative effect, and ketoconazole can certainly contribute to this, which can ultimately lead to life-threatening ventricular dysrhythmias, such as torsades de points. So pay attention to that. QT prolongation is a significant risk. Remember, I've got a good blog post for QT prolongation at meded101.com and community pharmacists, things to look out for there. Had a great guest post on that, so if you want to take a deeper dive on that, just Google search Meded101 QT prolongation for community pharmacists, and you should see a good discussion on medications and things to look out for and those type of things. So definitely go check that out. All right, well, I think that's going to wrap up the podcast for today. Hopefully you picked up a few practice pearls. Do me a huge favor, share the podcast, friends, colleagues, classmates, students, anybody who could benefit from some pharmacology education. I greatly appreciate that. Leave a rating review on iTunes or wherever you're listening. I greatly appreciate that as well. And of course, go get that free 31-page PDF on the top 200 drugs. Simply an email will get you access to that. Do that at reallifepharmacology.com. If you got any comments, suggestions, feel free to reach out to me, Eric Christensen, PharmD, BCPS, BCGP. Connect with me on LinkedIn. Otherwise, my email, mededucation101@gmail.com. Send your comments and suggestions to that email if you would. Thanks so much for listening. Take care, and I hope you have a great rest of your day.